How long does Suboxone take to kick in? Some prescription medications take time to be absorbed, and sometimes the effects can take an eternity to kick in. Unfortunately, this part of getting better can be frustrating when you attempt to combat opioid use disorder or OUD. The good news is that Suboxone is not one of those medications. In most cases, you will feel the effects of this treatment relatively quickly. To learn more about Suboxone and what to expect from the treatment, here is a curated guide on how long Suboxone takes to kick in. Suboxone is a medication-assisted treatment, or MAT, used to treat opioid use disorder, or OUD, and other substance use disorders. It comes in a sublingual film or tablet that dissolves under your tongue. Suboxone contains two active ingredients, buprenorphine and naloxone. Buprenorphine, an opioid partial agonist, reduces cravings. Naloxone, on the other hand, reverses and blocks the effects of opioids. Suboxone treatment is part of dual diagnosis treatment that combines behavioral therapy to understand the patient's mental health and medication to ensure life after treatment in long-term sobriety. Your doctor will most likely prescribe Suboxone if you currently take opioids, such as heroin or painkillers. Suboxone is best suited for you if you want to stop OUD or are in an opioid detoxification program and are going through withdrawal. Suboxone has a ceiling effect. Once you reach a specific dosage, taking additional amounts will not result in significant effects. It creates a sense of safety for those trying to detox and avoid relapsing in an opioid overdose. Some factors affect how long Suboxone can take effect. Some may include your age, weight, metabolic system, history of abuse, and other lifestyle factors. These factors can affect how your body breaks down and uses the medication. Suboxone may not show effects immediately, so speak with your doctor if you don't feel any changes. You must not self-medicate and strictly follow their daily dose and frequency guidance to avoid harmful side effects. The goal is to reduce the medication needed to bind efficiently in your treatment plans. In some cases, your Suboxone doctor might increase your dosage. However, if you discontinue your treatment abruptly because you feel it's not working, you may experience opioid withdrawal symptoms. Hence, you must be patient and wait for the medication to take effect. The tablet works perfectly, just like the film. However, some people may prefer the film as it dissolves faster. Remember that the tablet and the film must be placed under your tongue and should not be chewed or swallowed. Doing so will make it ineffective. In general, Suboxone takes a few minutes to dissolve under the tongue. Once fully dissolved and absorbed, it will take effect after an hour or so, depending on your condition. While some may feel the effects immediately, others might not experience them until a few hours later. On average, it can take anywhere from 4 to 5 minutes to an hour for Suboxone to kick in fully. You must stay patient and give the medication time to work. If you don't feel any changes after an hour, you should consult your doctor to move forward. The side effects of Suboxone are different for everyone. Others may not even experience them. Some of the most common side effects of Suboxone include drowsiness, nausea, headache, vomiting, dry mouth. Remember that these side effects are temporary and should dissipate as your body gets used to the medication. If they persist, you must consult your Suboxone doctor immediately. A timeline for treatment can be different for everyone, as it depends on how your body reacts to the medication. Most people generally stay on Suboxone for a minimum of 6 months. After the stabilization period, your Suboxone doctor will prescribe decreasing doses. Once you show significant progress, based on factors like sobriety markers and length of time in the treatment program, your Suboxone doctor will lower the dosage until you are eventually off Suboxone. Your doctor will refer you to aftercare programs for additional support. Suboxone treatment is tailored to your needs and condition. With the right medical team, you can confidently navigate the treatment process and come out stronger on the path to recovery. At Suboxone Doctor, we will connect you with only the most qualified Suboxone doctors and clinics across America. With round-the-clock care, we ensure you receive a comprehensive Suboxone treatment tailored to your needs and condition. Visit us today and take the first steps to your future without opioids.